She woke up during brain surgery, completely paralyzed, feeling every cut, but what she heard the doctors confess was even worse. Amanda Torres was 34 years old when she began having unexplained seizures. Mother of 2 children, math teacher, ordinary life. The episode started subtly, hand tremors, brief moments of absence. But within 3 months, they evolved into complete tonic-clonic seizures. After a battery of tests, an MRI revealed a lesion in the left temporal lobe. A benign tumor, technically, grade 1 meningioma, curable with surgery, success rate 97%, minimal risk. Dr. Ricardo Valen would be the neurosurgeon in charge. 15 years of experience, over 200 successful craniotomies. Santa Cruz Hospital, a reference in neurology. Everything indicated it would be just another routine surgery. Amanda signed the consent forms. She read about the risks: hemorrhage, infection, neurological damage, standard stuff. But there was one line in the form she didn't pay attention to: intraoperative awareness, estimated risk of 0.1 to 0.2%. 1 in 500. Nearly impossible. Amanda would be that one. October 17th, 7 in the morning. Amanda was taken to the operating room. The anesthesia team administered midazolam for initial sedation, followed by propofol for anesthetic induction, and rocuronium for complete muscle paralysis. Or at least, that's what was supposed to happen. What no one noticed was that the propofol infusion pump had a silent failure. The flow dropped to 20% of the programmed dosage, not enough to trigger an alarm, but enough for Amanda not to receive adequate anesthesia. At 7:42, Dr. Valen made the first incision in the scalp. Amanda felt it. She felt the pressure, the cut, the sharp pain crossing through her scalp. She tried to scream. Nothing. Tried to move. Impossible. The rocuronium had worked perfectly. She was completely paralyzed, but conscious. Completely conscious. Her mind went into panic. She tried to force her eyes open. She couldn't. Tried to accelerate her breathing. The mechanical ventilator controlled that. Tried to make any movement, any sign. Nothing responded. It was like being imprisoned inside her own body, feeling every second of the surgery happening. The sound of the electric saw cutting through the cranial bone echoed inside her head, literally inside. Deafening vibration, nameless pain. Amanda tried to pass out, escape into unconsciousness, but she was trapped in a state of forced wakefulness, an involuntary witness to her own surgery. Then she heard the voices, clear, sharp, the team talking. "Intracranial pressure stable," said a female voice, the scrub nurse. "Great, let's expose the tumor," Dr. Valen responded. Suction sound, metallic smell of blood. Amanda felt everything. The electric scalpel cauterizing vessels, the retraction of brain tissue, the manipulation inside the skull. Each movement resonated through her paralyzed body. That's when the conversation changed tone. "Doctor, about last week's case," began another male voice. The anesthesiologist, Dr. Marcos Leitão. There was a pause. "Not now, Marcos," Dr. Valen said, voice low. "We need to talk about this. The family is asking questions." "What questions?" "About the cause of death. They want a second opinion on the autopsy." Silence. Only the sound of the equipment. Then Dr. Valen's voice, even lower. "And what did you say?" "That we followed all protocols, that it was an unforeseeable complication." It was, Dr. Valen stated, but there was something in his voice, something that Amanda, even through the fog of pain, recognized. It was a lie. "Ricardo," the anesthesiologist hesitated. "We both know it wasn't." The sound of surgery stopped. Amanda imagined Dr. Valen raising his eyes to face him. "You want to rephrase that, Dr. Leitão?" "The dosage was wrong. I reviewed it 3 times before administering, but later, when I went to check, Someone had altered the prescription in the system, and the only person with access besides me was... Careful what you're about to say. It was you, Ricardo. You altered the dosage an hour before surgery. Amanda's heart was racing. She couldn't see, couldn't move, but every word entered clearly into her conscious mind. They were talking about another patient, about a death that wasn't an accident. Lower your voice, Dr. Valen hissed. You're delirious. Stress is affecting you. I'm not, and you know it. Patient was Hugo Carvalho, 62 years old, benign tumor, simple surgery. But you doubled the preoperative anticoagulant dose. I didn't understand at the time, thought it was extra precaution. But during surgery, uncontrollable hemorrhage, he died on the table. Complication, it happens. It happens when someone causes it. Ricardo, why? Why would you do that? New silence. Longer. Tense. Amanda was terrified, but couldn't stop listening. She was trapped there, witness to a murder confession happening during her own brain surgery. You don't understand. Dr. Valen finally spoke, voice loaded with something Amanda couldn't identify. Regret. Fear. Hugo Carvalho wasn't just a patient. What does that mean? It means he knew things about the 2019 clinical trial. Amanda heard someone take a deep breath. The experimental drug trial? The one that was cancelled. Officially cancelled. But 3 patients had already received the drug before cancellation. 3 patients who died in the following weeks. Official cause, post-operative complications. Real cause, the drug destroyed their blood-brain barrier. My God, the anesthesiologist whispered. Hugo Carvalho was the brother of one of the patients. He was investigating, had documents, recordings, emails, was going to expose everything, was going to destroy the hospital, the team, all of us. So you killed him. I protected 40 jobs, protected the reputation of an entire institution, protected you too, Marcos. You were on the anesthesia team for that trial. Your name is in the reports. Amanda wanted to scream, wanted someone to know she was hearing everything, that there was a witness. But she was imprisoned in her own body, invisible, silent, while 2 men discussed murder over her exposed brain. You're insane, Dr. Layton said, completely insane. I did nothing wrong in that trial. I followed protocols. But your name is there. And if the truth comes, out you'll fall with me. We all will. So I suggest you forget this conversation and keep doing your job. Because if Hugo's family keeps investigating and you decide to have an attack of conscience, I guarantee your name will be prominently featured in the lawsuit. Absolute silence. Then Dr. Valen's voice, now professional and cold. Let's continue. I need to remove the tumor before we have significant edema. Marcos, adjust the anesthesia. Patient may be showing response to stimulus. Vital. Signs are normal, the anesthesiologist responded, voice trembling. Even so, we don't want intraoperative awareness, do we? It would be terrible for the patient to wake up feeling all this. The surgery continued for 2 more hours. Each minute was an eternity for Amanda. The physical pain was horrible, but the psychological terror was worse. She knew about a murder, knew the man operating on her brain was a murderer, and knew that if he discovered she had heard, she would be next. When adequate anesthesia finally began to take effect, Amanda sank into darkness with a mixture of relief and dread. Relief from escaping the pain, dread of what would come next. She woke in recovery 8 hours later, nurse at her side, smiling. Welcome back, Amanda. The surgery was a complete success. Amanda tried to speak. Dry throat, hoarse voice. Water. Of course, dear. I'll get some. Alone for a few seconds, Amanda tried to process. Had it been real? Or anesthesia-induced hallucination? Had she really heard that? Dr. Valen entered the room, professional smile. Amanda, how are you feeling? She looked at him. That man had killed someone. She was certain. But what could she do? Who would believe her? Dizzy, she managed to say. Normal. The surgery was perfect. We removed the entire tumor. You'll be fine. He grabbed the clipboard, made notes, then looked at her with an expression Amanda couldn't decipher. Any problems? Anything you want to tell me? Her heart raced. He knew. Somehow he knew she had heard. No, she lied. Just tired. Great. He smiled, but the smile didn't reach his eyes. Because sometimes patients report strange dreams, hallucinations during surgery. It's an anesthesia effect. None of that is real, understand? Just the brain creating false narratives. I understand, Amanda whispered. Wonderful. Rest. I'll stop by tomorrow to see how you're doing. He left. Amanda lay staring at the ceiling, trembling. That hadn't been subtle. It was a veiled threat. He knew she had heard something and was telling her to forget it, to treat it as a hallucination. Amanda was discharged 3 days later, went home, tried to return to routine, but couldn't forget. Every time she closed her eyes, she heard the voices. Hugo Carvalho. He knew things. I protected all of us. A week after surgery, Amanda made a decision. She searched online. Hugo Carvalho, Santa Cruz Hospital, found the obituary. 62 years old, deceased during surgical procedure. Survived by wife and 2 children, found more. A small article in the local newspaper. Family questions hospital death, lawyer requests case review. Amanda noted the lawyer's name, Dr. Henrique Montero. She scheduled a meeting. In his office, she told everything, every word she heard during surgery. The lawyer listened in silence, taking notes. You understand, he said when she finished, that legally this is complicated. You were under the influence of medications, undergoing brain surgery. A good defense attorney would argue everything was a hallucination. I know what I heard, Amanda insisted. I believe you. And if we combine your testimony with what we already have, irregularities in Hugo's medical record, strange dosages, maybe we can open a formal investigation. Then let's do it. Are you sure? These people are powerful. Santa Cruz Hospital has connections. And if you're right about the 2019 clinical trial, there's a lot of money involved. A lot of money from very dangerous people. Amanda thought about her children, thought about returning to her life, pretending nothing had happened. It would be easier, safer. But she thought about Hugo Carvalho, about his family, about the justice they deserved. I'm sure, she said. In the following days, strange things began to happen. Amanda noticed a black car always parked in front of her house. She received anonymous calls. No one spoke, just heavy breathing. Her computer was hacked, files deleted. Then came the first direct threat. A text message from an unknown number. Anesthesia effects can last weeks. Hallucinations, paranoia. I suggest seeking psychiatric help before your fantasies harm innocent people and your family. Family. They threatened her children. Amanda panicked, called the lawyer. They're following me, threatening my children. Go to the police. File a report. She went. The detective listened patiently, but when she mentioned Santa Cruz Hospital and Dr. Valen, his expression changed. Mrs. Torres, I've known Dr. Valen for 20 years. He operates on the mayor's mother, the prosecutor's father. He's one of the city's most respected doctors. You're telling me he committed murder and is now threatening you? Yes, I heard during my surgery. During your brain surgery, while you were anesthetized. Amanda saw the disbelief in his eyes. It wasn't a hallucination. I know what I heard. I'll record your complaint. But honestly, my advice is to seek psychological counseling. Brain surgeries are traumatic. It's common to have paranoid ideations after procedures like this. She left the police station knowing she was alone. 2 weeks after the police report, Amanda's lawyer called urgently. "I need to speak in person, now." In the office, he was pale. "Amanda, I'll be direct. Someone broke into my office last night, took all the Carvalho case documents, physical copies, digital backups, everything." "How?" "Professionally. No visible break-in, no cameras. Triggered. Whoever did this knew exactly what to look for." He ran his hand over his face. "And there's more. I received a call from the hospital president. They offered a settlement, 50,000 reais for the Carvalho family to drop the case, and strongly suggested I accept." "And will you accept?" "Amanda," he sighed, "I have a family too. And without documents, without physical evidence, we only have your testimony, which can be easily discredited. It's not cowardice, it's realism." Amanda felt despair rising. "So Hugo Carvalho won't get justice?" "I don't know, but I know you need to stop before something worse happens." "Worse how?" As an answer, he slid a folder across the table. Inside, a medical report. Amanda read, "Patient Amanda Torres, emergency readmission, late intracranial hemorrhage, death." She looked at him confused. "What is this?" "It's a draft, incomplete. It was sent anonymously to my email this morning, with a message. Post-surgical complications are unpredictable. It would be tragic if Amanda Torres had a recurrence." Her blood ran cold. "They're planning to kill me. They're making it clear they can, at any time, and make it look like a natural complication. So what do I do? Disappear. Take your children and go far away, change city, state, start over. And Hugo? He's already gone. You're still alive, keep it that way." Amanda left the office numb, went home, looked at her children playing in the living room, thought about uprooting everything, running, living in constant fear, or she could do one last thing. Amanda recorded a video, told everything, every detail of the surgery, every word she heard, every threat she received, included documents she had managed to gather before the break-in, copies of emails, photos of the car following her, screenshots of messages. She configured it to be automatically published on multiple platforms if she didn't cancel the upload weekly. A digital life insurance. Then she sent a copy directly to Dr. Valen with a simple message. "I know you can kill me, but if I die, everything comes out. Every detail, every name, 2019 trial, Hugo Carvalho, everything. You have two options: leave me alone and live with constant paranoia, or kill me and guarantee your own destruction. Choose wisely." For 2 weeks, nothing happened. No calls, no threats, no black car. Then an envelope was left in her mailbox. Inside, a single sheet. "You won. But understand, it wasn't because of your courage. It was because other people need Dr. Valen alive and functional. People more important than you or me. People who keep the hospital running, the local economy turning, profitable projects happening. Hugo Carvalho was a threat to much more than you imagine. And now you are too. But a controlled threat. You have your video. We have your children at school every day, your mother in the nursing home, your brother at the office. A delicate balance of mutual destruction. You stay quiet. We stay away. You speak, everyone loses. Welcome to silence." It wasn't signed. It didn't need to be. Amanda Torres is alive. Her children are well. She returned to teaching. Life, externally, returned to normal. But she was never the same. Every medical appointment is a torment. Every hospital she sees on the street triggers anxiety. She knows too much. And she knows that knowing too much is a life sentence. Dr. Ricardo Valen continues operating, continues being a reference in neurosurgery, received an award for medical excellence last year. His patients love him. They don't know that the man who saves lives in the morning also takes them when necessary. Santa Cruz Hospital was never formally investigated. The 2019 clinical trial remains filed in documents no one will review. Hugo Carvalho is buried with official cause of death, unforeseeable surgical complication. And somewhere, there are other Amandas. Other patients who woke during surgeries and heard things they shouldn't have. Others who know but cannot prove. Others who live in the impossible balance between truth and survival. Intraoperative awareness officially affects 0.1 to 0.2% of patients. 1 in 500. But how many of those woke up in the wrong surgeries? With the wrong doctors, at the wrong moments? How many heard confessions, secrets, crimes, and how many decided that living with the secret was better than dying for the truth? Amanda Torres's story teaches us something disturbing. Sometimes the truth doesn't set you free. Sometimes the truth imprisons you. In a game where all sides have nuclear weapons, the only possible victory is not to play. But what about Hugo Carvalho? And the 3 patients from the 2019 trial, and all the others who died to protect profitable secrets? They remain dead. Their killers remain alive, respected, well paid. Because in the end, the system wasn't made to punish the powerful, it was made to protect them. And when the choice is between justice and survival, most choose to live. Tell me in the comments, would you do what Amanda did? Would you risk everything for the truth? Or would you accept silence for safety? Do you trust your doctor blindly? Or do you question what happens when you're unconscious? If this story made you question what really happens when you're under anesthesia, subscribe to the channel. Every week, I expose cases that hospitals don't want you to know about. Truths that remain buried in confidential medical records and isolated operating rooms. Share with someone who's going to have surgery soon, not to scare them, but to remind them to ask questions, to verify, not to trust blindly. Because sometimes waking up in the middle of surgery is the least of your problems.